Hey, thanks for checking out my second video. So let's just jump right in. Of course, I was diagnosed November of 2007, and we have yet to find an MS medicine that actually works for me. And when I say works, I'm talking about slowing down the progression of the disease. We did try a medicine. After a few medicines, we did try a medicine called Tysabri, which was through an IV infusion every 4 weeks, and it did slow down my MS. But about a year and a half later, I was tested for a gene for the JC virus, which, when you take Tysabri and you carry this gene, you run a high risk of developing PML, which is a brain cancer. It took a year and a half for us to discover that. It's a simple blood test, but it wasn't done because my doctor said the odds of me carrying it were slim. Yeah. So that was quickly X'd out. And I guess I know I was asked about living day to day. Really, day to day is just a surprise. I'm on permanent disability since I was 20. I'm 27 now. Um, I I'm married and I have a daughter, a beautiful daughter, and some days I'm Monica and some days I'm MS. And when I'm Monica, I'm lively, I'm dancing, getting it, just having a good time. But when I'm MS, I'm literally balled up in the bed or in a wheelchair and just crying because it hurts so much. Like, the pain is ridiculous. I don't know how to deal a lot of the times. It's a trip. The thing about that, when I have relapses, when I'm going through MS, it can last 2 days, it can last 2 weeks, it can last 2 months. Like, you really just don't know, and it can happen just like that. You really don't know. It all depends on the severity and the placement of the lesion, or what I call cut, on your brain or spine. Doctors have yet to discover, or research has yet to discover, if MS attacks other organs. I'm crossing my fingers that it doesn't, but we'll see. There's no cause, there's no cure for MS, so it's kind of hard to play with. Since doctors do have to do something for me, we have focused on my pain management. And I have been on over 50 different oral medicines for my pain, and zero have worked. I'm allergic to Motrin and aspirin, so that does nothing for me. Tylenol, all that stuff. So we've tried stuff like morphine and all that, but that does nothing. It's like popping candy. Um, I've also had two nerve blocks where they go in and block a nerve or deaden a nerve in my head, and that's to stop a signal from reaching the brain. It's very interesting, and you have to be awake for it, and I kind of hate it. And it does nothing. So if it did something, I'd be like, whatever, it doesn't matter, but it did nothing. Um, in December 2012, some relief did come, and I was extra excited, and that was through a lidocaine infusion. And lidocaine is that medicine that they use to numb you before minor surgery or something like that. And they put the IV in my arm, they laid me down. This is all done at the hospital. And they pumped that lidocaine through my veins, and that was the best 24 hours of my life, aside from having my kid. But that was the best 24 hours. I felt nothing. I don't remember too much. I do remember that I wasn't in pain and that I was able to sleep without nightmares, or it was crazy because it worked. Like, it really worked. And then fast forward a few months later, I think 3 months later, in February 2013, a cardiac MRI had to be done, because my heart rate was really, really fast. And we found a blockage in my heart. So I was sent to an open heart surgeon because that's what they were thinking they were going to have to do. And upon further looking at the MRI, they saw that my heart found another way to work around that block. So, yay, we were high fiving in the parking lot. No open heart surgery. I'll take that any day. With that said, I can't have lidocaine infusions anymore because it increases my heart rate too much, and my heart rate already beats too fast. Um, So I'm not trying to mess anything up. So we're gonna just deal with that. I'll deal with the pain, I guess. October 1st, I did try a new MS medicine called Tecfidera, and for the first 17 days, it did make me very, very nauseous. So we had to lower my dosage, and we're gonna try to work my way back up. October 22nd, I tried a new pain medicine called Nucenta. And the crazy part about that is it made me really, really sick, and it made me feel my pain. I don't know if I developed some sort of sensitivity to my pain or what whenever I have a pain medicine, but I'm not sure what we're going to do with that. I think we're going to play around with the dosage, half a pill, things like that, figure out what we can do. On a brighter note, I did have an MRI last week, and I'm currently waiting for those results. And if this phone rings right now with the results, I'd be extra excited because I need to know the progression of my MS, because we know that it's still progressing. We just don't know how much. So I will let you guys know what exactly the MRI results are and what they say when I find it out. So thank you for watching this video. I know it's 6 minutes long, but I really, really appreciate it. Let me know with comments, questions, all that stuff, so that way I know what else to say, what else to do, what else you want to know. Okay, thanks. Bye.